This is Juliette Healthcare, an assistant manager of the Human Resource Department at the Stronger Memorial Hospital. In this video, I want to discuss more about the health career in general. Basically, what you have to know is that the career of healthcare is divided into two main parts, which are clinical and non-clinical departments. The clinical department is the one which deal with the people who works in the clinical departments are the ones who deal with the patient, like the process of the treatment of the patient. However, the non-clinical department is the ones where who deal with the business part of the hospital or the healthcare institution in general. So that non-clinical department has many job titles. I want to discuss about three simple of them. The first one is medical transcriptionist. This person is the one who record patient information or histories and make them clear so that anyone can access them. And the knowledge which is needed here is to know medical terminologies and language. This helps them to be able to transfer abbreviated words into normal words that all people can be able to read and use such information. Also, there is another job title which is medical secretaries. This person deal with the business side of the healthcare institution, and the skills that they have to have are medical office skills, the skills which are needed in offices, in any business office in general. And those skills are mostly office softwares and others which are needed in offices, and they also need to know general terminologies that are used in medicine, which can be used in their job, everyday jobs. And there are trainings which are available for them to gain those skills, which are trainings which used to happen in vocational or secondary school, when they are finishing their high school, or trainings in institutes or community college. All those they can offer those skills. There is also health information manager and technicians. For this, it's deal with managing the information, the flow of information in healthcare settings in general. And these persons don't interact with patients. However, they're the ones who deal with their information. Therefore, they have to know medical terminologies and be familiar with them, medical law and medical coding system, so that they do their job effectively. In order to prepare those health information manager and technicians, they have to have a bachelor's degree in that field. It is mostly offered in colleges, and there are also associate degree which is usually required. And for this, they work with charts and other medical information to keep them and make them useful in the healthcare settings. Also, I want to talk about the allied healthcare professionals. Allied health professionals is a part of healthcare field, but it deals with diseases study on a certain disease, how to identify it, evaluate it, and prevent from prevention against that disease. It means that for this, it has specific disease that they study about and like treat about. There are many allied professionals. Some of them include athletic trainings, audiology, dental hygiene, dietetic, physical therapy, health information management, and many other related fields. Let me first start by discussing about the athletic trainer as a healthcare allied professional, and this healthcare athletic trainers works with people who have injured by physical activities. Like if you have been doing the sport and you got injured, and those people can help you a lot more than getting medical treatments. They help you to recover without passing through different medical process of treatment. And part of what they do is sports, doing physical activities which can help your body to recover if you have a certain problem. They have different working conditions. Most of them works in schools, in hospitals, in some other organizations which promote the sport in general. Audiologists. For audiologists, they are also called doctor of audiology. They're the ones who deal with hearing problems like hearing and balance of and other related disorders. Audiologists are experts in non-medical diagnosis, and also they manage the disorders associated with hearing. And their job is to identify and assess the hearing and balance problems. They also works with rehabilitation persons with hearing and also balancing disorders. They also they are really necessary in preventing the hearing loss. They can use psychology path during their treatment, or they work also with medical departments to enhance the welfare of the population in general. They also work in counseling family members, patients, or caregivers. They also work with language, speech languages, and people who works with preparing things to engineers, educators, scientists, or pathologists. Many people in the health field or other connected field to make sure that people the population does not lose their hearing capability. And they also deal with many all parts of the population, whether they are young, old, or any other person, because anyone can lose their hearing capability. And their job is to make sure to evaluate that problem from its starting and until it ends. Another allied health professional is health information management. This profession deals with the management of health information, and it starts from the information that the patient provides. When during the consultation, when the patient is saying how he's feeling, symptoms, explanation about all all his or her feelings, and until what the doctor or the provider tell the patient. In this case, those health information manager are supposed to keep the information safe, like no one can access them, like the safety of the information, the secret. They are kept like technologically in the computers, and they can be accessed in case they are needed. And also the quality of information. Those people are the ones who record those informations. They have to make sure that all those information are qualified so that they can be useful during the treatment of the patient. Also, another thing is that they usually work like as full-time employees in healthcare settings, and all information that are needed in a certain healthcare setting, they're the ones who keep them and are the ones who are supposed to deliver them in case they are needed. And another allied health profession is dental hygienist. Those are the ones who deal with the oral health in general. They're the ones who are supposed to evaluate or examine how the like disease or abnormality that someone can have in his or her teeth, or in the mouth in general. And those ones are the ones who treat them effectively, like the ones who deal with any symptom, any disease which is associated with the oral part of the human being. And they work with medical practitioners in case they are needed, because someone may suffer from a disease and need like the oral part of him or her can be affected. In this case, they work together to make sure that that person, to ensure the health or the safety of the individual. Another allied health profession is nutrition or dietetics. This deal with the food people eat in their everyday life. It is stated that what you eat is what you are. Means that if you eat health food, it means that you also your life will be affected positively, and if you don't, also your life is likely to be affected negatively. So in those nutritious or dietetics are the ones who are supposed to design like food therapy, foods that a person is supposed to eat so that so that he or she feels healthy. And also they're supposed to prepare menus and recipes which shows foods that people should consume in order to help their life to be healthy. And for this dietetics helps people to live improved life without like the use of medicine. Just what you eat help you to live a good life, because you eat those foods are the ones which your body uses, in like which feed your bodies, and what you like in your working activities, what you do, and all those are helped by the nutrients that you found in your food. And this health profession helps people to eat foods which are like which are healthy, and which are also cost effective for all people in general. Okay, let me also discuss about the nursing. Like nursing, mostly I want to discuss about registered nurses and licensed practical nurses, and also nurses practitioners. And registered nurses are the ones who have like the responsibility, the ones who treat the patient physically, the ones who do the consultation, the one who supervise the treatment process of the patient, the ones who lead the like the treatment process of a certain patient, but joining hands with other physicians and specialists. And but he is the one who is responsible for like the to lead the process, the whole process of treating a certain patient. And for these ones have the masters education in health science, and they also used to have licenses which are given to nurses. Licensed practical nurses must have a state approved educational program which allow them to work as like in health settings as nurses. There are also like practical nurses. Those are the ones also who works under the supervision of registered nurses, and they're the ones who deal with like any care, health care that is recommended by the registered nurses. This can be a wound care, giving medicines to patient, implementing what has been recorded by the registered nurse, and other process that can be asked by the registered nurse to do. And those used to have the associate degree in nursing. Thank you.